I'm Linda Marks and I'm advancing Missouri's health. The Mobile Eye Clinic started seeing patients the fall of 2003 after they renovated the motorhome and put the eye exam lanes in. My work on the Mobile Eye Clinic is advancing Missouri's health because we are providing eye care to children who wouldn't normally have it, and we can also, in addition to prescribing glasses, pick up on eye health conditions, and in those cases let the parents know that the child might need further treatment. It is advancing the exposure and the experience of our interns at the College of Optometry. They need to see patients from all different facets of life, all ages, and all different settings. So it's a really unique experience that our students are allowed to travel around to these different schools and see how important it is to be involved in the community. I think what sets the Mobile Eye Clinic apart from other health initiatives in Missouri is just our accessibility, the fact that we're going into the schools and seeing children that might not even get an eye exam otherwise. The Mobile Eye Clinic is really a team effort from the College of Optometry, so a lot of different people help out so that I can go and provide eye care to the children.
I'm Krista Hughes and I'm advancing Missouri's health. It's now 1 in 110 children are affected by autism. So there's an increased need to, number one, diagnose early, because the earlier diagnosed, the better chance the child has to improve their abilities and can be best mainstreamed, I guess is the best way to put that, into school. And the earlier they get diagnosed, the sooner they can get interventions, which in some cases can give the children the best quality of life so that they can grow up and have jobs and families like anybody else. The Thompson Center has basically provided families with a place to go to get that early diagnosis and early intervention that they may not have otherwise had the ability to get. And to see the smile on the family's face, that they, it gives you a sense of we're doing something for them, and it's making their quality of life better. They don't feel alone, so you feel good about that. But the kids, they're amazing. I'd say we're advancing Missouri's health by providing a place for the family, to what we call a health home for them to come to, that they can get the services that they need. It keeps you motivated because you think if they have to deal with this every day, then I certainly can do something to help them in the future, hopefully. So.
I'm John Graham. I'm advancing Missouri's health. I remember one night my parents went out to dinner or to a party, and I was just kind of hanging out at home alone. And then it hit me that I have cancer. I'm going to lose my hair. I'm going to feel crappy. Everything's going to change. Since my mom was a doctor at the hospital, I was like, you know what? Can I just shadow a few, see what happens? What I do remember is shadowing a general surgeon there, Dr. Voigt. He was the most amazing doctor that I've ever been around. I remember going on rounds with him to different patients, and there were families in the room with the patient when he would walk in, and the family and the patient would just light up when he walked in. He was just like so magnetic and so just full of confidence, and he just exuded everything that I was just like, wow, that's what I want to be. I want to help people, and I want them to respond and be confident in what I can do for them. I feel that, yeah, with my experience with going through the chemotherapy and being you know, a patient of a pretty serious illness does allow me to be more in the moment with the patient, like what the patient's going through. Cancer isn't a rare problem. There's thousands and thousands of cases every year, every week. And so no matter what field I go into, I know that I'm going to be dealing with somebody who has had or who has known someone with cancer. And so I know that I'll be able to, or at least I hope that I'll be able to relate with them and help them